Welcome to HRI Talks. I'm Roy Cameron. I'm a past executive director of HRI. I'm a last-minute fill-in for a moderator who was unable to be with us tonight, and I'm delighted to be part of this. I'm thrilled that we have 300 plus registrants from around the world, Canada, the US, the UK, Australia, New Zealand. It's really quite a remarkable response. There's a lot of interest in this topic, and we welcome you. The purpose of our talks is to promote the well-being of people who are dealing with mental health and addiction issues through applied research and drawing heavily on lived experience as well. I want to let you know that if you're wanting closed captioning, you can access that through the CC button on the Zoom screen. You can get both transcripts and closed captions. I'd like to do a land acknowledgement. HRI offices are in the traditional lands of the Anishinaabe, Haudenosaunee, and Métis people and the treaty lands of the Mississaugas of the Credit. At HRI, we acknowledge that our history as settlers has caused suffering and trauma to a great many people, and we frequently reflect on the deep and lasting impact of these traumas. We support the Truth and Reconciliation Commission calls to action and work to be more inclusive in our research and our everyday practices. We genuinely want to do our part to promote reconciliation and healing. And this is not a pro forma statement. If you have ideas about how we can do this better, if you see opportunities for us to contribute more, please be in touch. HRI is a national charity focused on applied research to improve mental health and substance use services to benefit as many people as possible, as quickly as possible. We work with scientists across Canada, in the US, and around the world, with clinicians and with people who have lived experience in order to do real world stuff that can make a difference. We are supported by donations. If you're inclined and able to donate, please go to the HRI website. I want to thank our corporate sponsors, CIBC, and co-sponsors, KPMG and Atsuka Lumbeck Alliance. Let me just give you an overview of what will happen. We'll spend about 30 minutes with a moderated discussion with our 4 panelists. This discussion is built around questions that came in when people registered. Then we'll shift at about 25 to 8 to live questions from the audience. And if you'd like to submit questions, please use the QA button to do that. And we'll get to as many questions as we can. And we ask everyone to maintain a respectful tone as we go through this. So I want to thank our panelists. Dr. Onawa LaBelle is an assistant professor of psychology at the University of Windsor and a collaborating scientist at HRI. She has lived experience with addiction and has been in recovery for 18 years. She has a PhD in psychology from the University of Michigan, and she draws on the field of positive psychology and lived experience to study recovery from alcohol and substance use disorder. Shawn Fisk is Systems Stigma Navigator. He comes to us from the Community Addictions Peer Support Association, CAPSA. I know the acronym, I have to struggle with the words. CAPSA, which is a national organization of experts informed by their lived and living experience with substance use. Shawn is a passionate advocate, educator, clinician, facilitator, and public speaker whose work is informed by more than 20 years of experience with substance use disorder. Like me, Shawn is a fill-in at the last moment, and we thank you for stepping up, Shawn. Garrett Smith is a Guelph-based filmmaker with lived experience with addiction. He works across North America and has many commercial credits as a director of photography for Ward 1 Studios. His short film, Hi Daniel, premiered early this year. It's an artistic interpretation of addiction and celebration of Garrett's 5th year of sobriety. Garrett's agreed to share this short 4-minute film, and we're about to view it now. But before we do, Garrett, would you like to say just a few words to set this up?
Yeah, absolutely. Thanks, Roy. I think before we view this, the one thing I wanted to say is that my intention making this film was never to make it about myself. My experience in, addiction and then in recovery informed the theme of the film, but it was never about me specifically. So I think I won't provide too much context beforehand. I think maybe we can view it, let the film speak for itself, and then afterwards, I'd be more than happy to share my thoughts and what role I play in the film.
You have 6 messages. First message.
Hi, Dan. Haven't heard from you in a while. Give me a call back when you can. Oh, and can you please call Mom and Dad? They've been asking about you.
I don't know how I let things get the way they did.
Hi, Daniel. It's Mom. Your dad and I were hoping to get together soon to celebrate your birthday. Hope you're doing okay. Give me a call back. Love ya.
It didn't happen all at once. It was slow. Until one day I looked at my life and couldn't recognize it.
Hey, Dan. I heard of what went down at work today. Look, man, I know you're going through some shit right now, but Christ, man, you're better than this. I'm sure you'll
It was affecting everything.
Hi, Dad. I don't know if this is still your number. Mom told me not to call. I wanted to let you know I'm moving to the city. I'd like to see you before I go. If you want to, of course. Okay. Bye.
I once heard someone say that addiction, it's like passing under a bridge in a storm. You can find a moment of peace when you're sheltered from the rain, but the storm is always waiting for you on the other side. My name is Daniel, and I'm ready to stop the storm. Hi.
Garrett, why don't you pick up and make the comments that you had in mind?
Sure. So maybe I'll provide a bit of context to who I am and how this film came about. So I was a young adult who was kind of lost in life and was, I guess, in the throes of addiction, and found myself celebrating my 22nd birthday at Homewood Health Center, which was not how I had imagined I would be spending my 22nd birthday. And so I had, I guess, reached a bottom with my addiction, and realized that I needed to make a change. And so that's Homewood plays a key piece in my story, because that's where it kind of all started. And I had always had a fascination for film and thought I might pursue that post-secondary, and it didn't work out. And anyways, along the way in my recovery journey, I kind of got back into the pursuit of being a filmmaker, and finished school and started working with a local studio in Guelph, Ward 1 Studios. And I've been working here since 2019. And about a year and a half ago, maybe around November or October of 2022, we were, I think, in the midst of another lockdown, and I was starting to feel kind of creatively starved and wanted to have some sort of creative outlet. And of course, my creative outlet is filmmaking. And so I was thinking about what that might look like for me. And I had kind of had this idea tinkering in my mind for a short film that sort of not necessarily mirrored my own story, but was influenced by it. And so that's where Hi Daniel came from. So obviously, Daniel is a fictional character, but the emotions and experiences he goes through, I think, are, I don't want to say universal, but I think very common when it comes to addiction. And so, the main one being isolation, and I guess the descent into the disease. And so at the start of the film, we see Daniel getting on his work boots, but we also hear a voicemail from a sibling who's reaching out and clearly, has been ignored for a little while. And then as the film progresses, we see the isolation progress and the addiction progress. It ultimately leads to a loss of a job. And then it's revealed that, he has a daughter, that clearly their relationship fell apart at some time beforehand. And so at this point, the addiction has taken everything but his life. And so Daniel's at rock bottom. And in the final scene, we get a good look at our main character for the first time. Up until this point, he's been mainly silhouetted, and that was sort of an artistic choice, was to keep him in the shadows in the beginning, and then, metaphorically, and I guess actually coming out of the shadows at the end, as he acknowledges his addiction and seeks help in a recovery setting.
That's a fantastic setup for this conversation, Daniel. Basically, when people submitted questions, a lot of it was about, how do I help myself when I'm on that trajectory? How do I enlist the help of others? And family members and friends asking questions about, how can I be supportive in that process? So thank you very much for setting it up so nicely. Onawa, I'm wondering if you could talk about your research as it pertains to the topic tonight.
I'd be happy to. Firstly, Garrett, wow, what a powerful piece that was. You depicted bottom really, really well. It was a powerful portrayal of what that looks like. And I loved the the seeing him for the first time in the light at the end. So I'm a person with lived experience as well, 17 years in recovery, long-term recovery. And for me, I went back to school after I got sober. I really identified with the parts of the film where, the isolation, there wasn't many people around, not contact with family. So I certainly identified with that. And I became really interested over the course of my studies in undergrad, graduate school, and now in my role as a professor, really interested in people in recovery and also in positive psychology and the intersection of those two things. A lot of my graduate level work also looked at attachment and relationships. And so I've done a fair amount of research at this point on social support, on intimate relationships. And, across the board, what we find is that connection really matters for people in recovery, right? It's the basis of, one of the oldest peer support programs in the world, right? The 12-step programs. My dissertation work found that when people in those programs specifically help someone else, they spend less time thinking about their own cares and concerns, right? So it's beneficial not just for the person that they're helping, but also for themselves. And it's cyclical, right? I'm paring it down quite a bit here. It was also about gratitude and a lot of other things, but similarly, in some other work I've done, I found really significant associations between peer support and positive outcomes, positive indicators of recovery. And then, so that's like the research that I do. And I look at a lot of different streams and different pathways to recovery, because there are a lot at this point. There's a lot of different ways you can go. So I'm looking at Buddhist recovery and gender specific recovery, like She Recovers, which I'm a part of in that organization as a trusted advisor. And really just the underlying thread between all of the programs. And I've looked at Life Ring, I've looked at, Red Road to Wellbriety, I've looked at Women for Sobriety, I've looked at religious approaches, and the theme among all of them, like I could not find a single one that didn't include an aspect of connection and peer support. And so, I think that's saying something, right? So this, the research side and a personal side in my own journey, it was the connection to the people that actually hooked me into the path that I chose for recovery, right? I had been isolated for a long time leading up until that point. And when I started to be around people who were in recovery and who were happy and laughing and happy to see me, that's where I really, I felt comfortable, and I felt that I was a part of something, and that, it gave me a little bit of hope. And I think that is a really important part of the journey and the process is experience hope through seeing it in other people, seeing it displayed and portrayed. So I'm really happy to be here. I'm excited. I'm looking forward to the panel discussion and answering questions.
Thanks so much. Again, a nice setup, and what both of you have said is that it can be very lonely. There's alienation of the people who care about you. And part of recovery is building connections again. And I'm wondering, Shawn, if you could talk about practical ways that people do go about building connection. Onawa has talked about it at, a high level in general, but specifically.
Okay, Roy, thanks for your question. And it's wonderful to be with this panel, and it's a privilege to be with all of you tonight. Maybe I'll just start with the concept of connection from sort of our perspective, and then we'll talk about how we go about doing that from a CAPSA lens. So what I'd say is, when we talk about connection, and if you go back to sort of the advertisement for this wonderful event, we talk about the opposite of addiction is connection. And I would offer that's not the whole story. Okay, I would say that I had lots of connection. Yeah, and we have a lot of connection regardless of what we're experiencing in terms of harms through substance use disorder, using substances as well, maybe not experiencing harms, right? So it may not be the opposite of connection with others. I would say that when I'm no longer living well and I can't sort of protect or hold my own health goals, and so now I can't connect with self anymore, right? And I'd say that the sort of determination we could look at is what are the root experiences of substance use disorder, and this is a neurological piece, right? So we don't want to go too heavy into the paint about neuroscience, but I want to say when I'm feeling unsafe, right, as a consequence of the symptoms of substance use disorder, when I can't move to that place of safety, I can no longer connect with self. If I can't connect with self, I can no longer connect with others. So sometimes I think there's a bit more to that story, right? It's a decoupling of my ability to be safe. It looks a lot like trauma, I think, And so one of the things that CAPSA has done, in terms of thinking about self-determination, individual agency, self-connection, safety, is we've created a low barrier, stigma-free environment by its nature, where folks can come and, sort of explore their relationship with substances, regardless of where they are at on a substance use health spectrum, in a way that it pertains to their health. And so I think that one of the things we do is we ground with folks. We bring them back to self so they can feel safe, feel grounded, and then connect with others. And so from my perspective, that's one of the really important pieces, right? Is to understand that as great as sometimes what would you say, phraseism and famous YouTubers and TED Talkers are, that's a wonderful idea when it comes to things like depression and the feeling of anxiety and mood disorders, but sometimes it doesn't translate to the whole picture of what we experience. We experience a decoupling from self.
Okay, and it sounds like it's a very welcoming organization is what I'm hearing. And if you approach this organization, you're encountering people who really understand you and who are meeting you where you are. That's what I'm picking up from what you're saying, Shawn.
Yeah.
Right, how do people access?
Yeah, and if I could just respond to that for a moment, right? That's that low barrier piece, right? So we long since hear support say we're going to meet you where you're at, but often that means on other people's timelines and other people's pathways. I heard Onawa say there's lots of pathways to wellness, and our foundational concept and organization is all people, all pathways, right? And so one of the ways people can access that is by finding our website, CAPSA, right? So www.capsa.ca, the Wellness Together Canada portal. And yeah, the point there is to have a low barrier situation where folks can feel completely safe without sort of an attachment of an expectation, right? And so we believe in the fact that people will find their own health goals. And so a lot of folks that are experiencing substance use, used and used substances, are experiencing harms or are experiencing substance use disorder, find that there isn't really a place for them across that spectrum. When they get to a place, they're told what they must do to qualify to even belong in some of these communities, not just healthcare, but some other communities. Whereas for what we're offering is you qualify just by wanting to be there.
That's a point worth emphasizing.
Mm-hmm.
I'm wondering about nuts and bolts. When I looked at the questions that had come in, people are looking for the most practical advice possible. And we've been focusing on the person seeking help and beginning to talk about some ways of finding help. How about supports, family members, friends, who really want to be supportive of somebody who maybe isn't interested in making change or doesn't appear to be interested in making change? What are your thoughts about how to be helpful in that situation?
I think from a peer wisdom perspective, we'd say that we're not asking family and friends and those who experience some of the unfortunate behaviors around substance use disorder. And we know that those aren't always acceptable necessarily. And we know that might be an okay thing for that not to be acceptable by our culture, these behaviors. We're not asking people to not have those frustrations. But what we are hoping is that people understand that we do want to be well. Sometimes
so don't give up on us despite our behavior.
Yeah, because we want to really decouple the behaviors from the medical condition we're experiencing. And we know that the primary sort of, what would you call it? The primary condition, the primary criteria is that regardless of whatever conditions are put on, whatever whatever punishments, whatever judgments may be put on, those things can be damaging, because regardless, I know that I'm going to continue to seek those substances compulsively, because that's the very definition of the experience I'm having if I'm experiencing substance use disorder. So I would say that kind of understanding, that training, that knowledge, and understanding that people get well on different timelines. Okay? And so not to have that arbitrary control, because I think self-determination and individual agency in terms of timelines must be a fundamental ingredient of the practice of compassion.
Yeah. This may be a good time to ask you, Onawa, about the role of positive psychology, some of the concepts there and how they might be relevant to this topic.
Yeah, I'd like to just weigh in and respond to what Shawn just said first before I go into positive psych. I absolutely agree with the things that you're saying. Everybody has a timeline, and it looks different for everyone. I also think, though, that often the people who are loved ones of someone who is using, they're active, they're engaging in that sort of behavior, use. I've just heard a lot of stories, both personally and through qualitative responses in my research, about the turning point or the bottom that you saw in the film, coming as a result of people setting some boundaries around what they're willing to do and what they're not willing to do, right? And so, maybe that looks like intervention, maybe it doesn't. Maybe it looks like being clear about what enabling is and not doing that anymore. So I think that for folks who are in that situation, they have a loved one who's using, maybe they don't want help, maybe they do at times, right? There's usually a pattern, like after a particularly bad drinking episode or using episode, there's this window where they might want help, right? The suggestion is to just be clear, have resources ready for when those times come, and try to get them help in that window, but then also be very clear about, what is the role of an enabler? What is codependency? What are those things, so that you can take care of yourself and, not put a cushion under the person when they're experiencing consequences, because it's often the consequences that lead to the change, right?
In your journey, you talked about going through an inpatient program. I assume it was an inpatient program. What were the steps that led up to that? Is that something that you're able to talk about?
Yeah, I can give a kind of a high level. I think it's kind of touches on the topic at hand, which I don't have a lot to say on, other than, my own experience was I had to hit absolute rock bottom before I was willing to get help. And so, having support systems in place after that was very, very important for me. But, and I was also, I wasn't at a place where I could ask for help. I knew I wanted it, and I knew I needed it, but I was not strong enough to ask for it. Maybe strong enough is not the right phrase for it, but I just couldn't bring myself to ask for help, even though it was, there for me if I were to, reach out for it. And so, to that, I would just say everyone's timeline is different, and you just gotta, you can't force recovery. In my experience, it came to me, and I was so beat down that I was ready to accept whatever was put in front of me. And that's what springboarded me to, I guess, where I'm at today.
What I'm hearing from you and others is not enabling, but standing ready when the moment comes, that help is welcome. And so that means doing some homework, maybe, understanding if the moment comes, what a good move might be. And you've offered us one, Shawn, your organization. Are there other doors that you'd encourage people to knock at?
I think I would offer sort of a question at this moment, if I could, Roy, which was, why would it be such with this health condition, with this substance use health struggle, that I must become so desperate to qualify for healthcare? Why would I have to hit a bottom in order to have support systems? Okay? And so I guess what I would say is the sort of inoculation of some of the stuff we're talking about is, is kindly put in the title of this wonderful panel discussion, which is substance use health, where we could talk about maybe having appropriate supports and understandings along the spectrum of use. And what that might do is rip some of those barriers out that we would say from our perspective and from my sort of position's perspective exist as systemic stigma. And so rather than have to self-diagnose as desperate enough, right, because now there's enough consequences. I mean, in clinical practice, and this is a heavy thing to say, and we don't want to go too far into the paint away from being trauma-informed in this conversation, but we often hear, right, maybe I'm not quite sick enough to get services, or maybe I'm too sick to get services, eh? And that's a really hard thing even for me to say, but I heard that many times. And many clients that I supported would say the same thing. And they'd say, you know what, maybe I'll just accelerate my use, or maybe during that intake, I'll just say that I'm in danger of harm, self-harm, just anything for that big button of help, eh? And so I just think, why should I have to? Right? So
what does a solution look like?
I think a solution looks like some of the work. I mean, I don't want to always go steer into what CAPS is doing, but this is kind of our wheelhouse a little bit, eh? So it's really pleasurable to be here and talk about this. It's a privilege. One of the ideas is looking at co-leadership, co-creation, right, with folks with lived experience, and integrated and stepped care, meeting me where I'm at actually, rather than that being sort of something that clinicians tote around, but I can meet you where I'm at if I'm compliant. I'll be met where I'm at if I'm compliant, or I'll be met where I'm at if I can get well through a specific system, and or interventionism, right? Which we know that statistically that doesn't work, right? We also know that agreeing with some of the smart panelists, right? Multimodal interventions, yeah, for sure. Peer support, for sure. And so again, we did offer a piece that we said the all people, all pathways. Peer support is great, but the principle or foundational concept of all people, all pathways says regardless of where you end up, the pathway you choose is good enough. Garrett said something smart about choosing your own recovery. Yeah, it's when you choose it. I just think that there's an unfortunate, scary, and sad issue when we have to be desperate to choose it.
Okay. I think we're at a point where we should switch to considering questions that are coming in from tonight's audience. And I'd like to introduce Hillary Dort, who won't appear on screen, but she's been fielding the questions and will put them to us as a group. Hillary?
Good evening, everyone. Thank you so much for joining us. So we've received a number of questions. Some came through at the time of registration, and some have come through during the panelist presentation. So I'm going to pull these forward, and we'll try to get through as many questions as we can. So for our panelists, there's a couple that are general that anyone can jump in on, and there's some that are a little more targeted. So the first one actually is for you, Garrett. It says, Garrett, can you talk a bit about who was involved in the creation of your film?
Yep, I certainly can. And one thing I was thinking about when we were kind of brainstorming what this discussion was going to be about, when we settled on this theme of community, there were strong parallels between the film and my own personal kind of recovery circle. So I am in the film at the end, in the circle. I'm to the right of Daniel. My mother is to the left of Daniel. She also is one of the voicemails. She's Daniel's mother in the film. And there was a lot of community, a lot of my personal community that had involvement in this film. Even you know, the whole production was funded through Ward One Studios. I brought the idea up to the owners here and told them that this was something that was it was something that I felt strongly about and was a good creative pursuit, I thought, and they were in my corner 100%, and made sure this came to life. So I had, you know, my family a part of it. I had my work a part of it, and it was informed by my experiences in, you know, the recovery community, specifically in Guelph. And so there were a lot of pieces of my life made their way into the film. Now, to be fair, some of it was just out of necessity. I couldn't find enough people to fill the circle in the last shot, so I had to make a cameo, and I bugged my mom to do the same. But I think that's just, you know, in hindsight, that's a strong testament to the people I've been fortunate enough to surround myself with over these last 5 years.
It sounds like this making the project was an important part of your experience of recovery.
Yeah, it was definitely
an important milestone.
Definitely a big milestone. Yeah,
that's terrific. Hillary?
Okay, great. Thank you, Garrett. I think that touches on a theme that I'm seeing in the questions, which is mostly around family and how family can support their loved ones who are experiencing substance use issues. So our next question says, I have a family member who is living with substance use problems. Is there a resource we can engage with together? As much as I can, I want to walk with my family member. How can I be a good ally?
I think just honest and open communication with the person, expressions of support, despite where they are on the continuum. I mean, it varies really substantially based on what level of acceptance they're at, if they're even being honest about what they're using, how much they're using, that sort of thing. So it's hard to make a blanket statement, but communication is absolutely key. And just support, you know, in some of my work, I've been involved with people and got close to people who wound up choosing to return to drinking, specifically in one instance. And I continued to reach out and support and, you know, make statements like, you know, wherever you are, I care about you. And I just wanted you to know I'm thinking about you. And if you ever want to talk. And I didn't get a response for quite some time. But when I saw that person a couple of years later and they had started again, they said, you know, it really made a difference. You really touched me. You were one of the only people that kept reaching out. And I just felt like you were there. And if I needed something, I could go to you. And, you know, maybe they'll be a bit better about connecting, and it won't be as complicated as that situation was, but communication for sure, and offering support wherever they're at. And I think Shawn will probably have quite a bit more to say about that.
As a segue to that, you brought to mind a conversation I had with a colleague who said someone who's a leader at CAPSA had saved a life that these two people knew in common. And he said that the person who was struggling with addiction had said, I've lost my hope. And this person said, I will carry your hope. And those words stuck. You know, I think what you're saying is very important, the walking with and communicating that clearly. And that person found it in those words. Shawn?
Yeah, the walking with, I like that this question names allyship, right? Walking beside us and walking with us. That's actually a truthful where someone is at moment. They're not behind us, pushing us, the timeline piece, right? They're not in front of us, pulling us or taking our story either, right? Standing beside us regardless of where we're at, like Onawa said, regardless on the spectrum. I think I would offer a few things. I'd circle back quickly to the idea that to believe someone when they say they want to be well, right? It occurred to me a lot of times that I wanted to stop, eh? Or that I was stuck and I couldn't get out, that hall of mirrors that some people can feel back in the middle of the maze. And so that's a really hard place to be in when you know to get well, you have to self-label and you're going to be stuck. And so I would say for family members, and I'll go off into a bit of personal piece and say that I work with family members in private practice a lot. And one of the really meaningful pieces is not just that communication, but understanding something. What comes up often, and it can be a little bit frustrating from my perspective, is that we don't tell the truth piece. And so I would offer, why don't we tell the truth? When someone doesn't tell you the truth, it's because they're fearful. And why would I be fearful? Because my fear system's been hijacked. And I know that if I tell the truth, I might have to stop. And if I might have to stop, I won't be well and I won't be safe. And that's a hard place and a lonely place for someone to be in, eh? And I don't even think that place is what creates that isolation. What creates that isolation is the stigma of all of this stuff we're talking about has now painted me into a corner where I'm no longer able to believe I'm a functioning member of society properly. And sometimes I wonder who taught me that that was so, because no one in my family or my supports ever told me that. And so that self-fear really puts us into a box. And so we again, behaviors we don't like, right? And so I get very wary about whether someone is or is not telling the truth, eh? And I usually offer to folks that, especially family members that ask me this, I say, well, do you always tell the truth, especially when you're so afraid? Okay? Because your only coping system, right? Your brain is telling you, I can't stop hurting myself because this is the only way I can save myself. And so, having been there and spent a lot of time with folks that have been there over the last 20 years, I can just say the best a family member can do is consider resources. And I will say one more piece if I can. There are really excellent family resources. We're one to talk about where service providers are less than helpful, let's say. But a lot of family services, should that person want you as an ally that way, you can walk directly into services with them. And I had that experience with family members of mine where we sat together with professional services. Many peer support organizations, also including All People, All Pathways, are happy to welcome family members and allies as well.
That's helpful. Are there places is there a website or a place that people could go to get an overview of resources that are available?
Shawn, I feel like it would be a great opportunity for you to maybe talk a bit about the All People, All Pathways meetings and how maybe that those meetings are open to everyone. Is that right? Yeah.
So one of the things we would say at a meeting like that, and it's just a gathering again of folks who want to have a safe space should they wish to share and explore their relationship with substances as it pertains to their health. So the barrier and stigma-free thing is that regardless of their relationship with substances at one time, someone might be practicing abstinence or harm reduction or different relationships with different substances. It's a real myth that those folks can't mix, eh? That doesn't come from us, right? We're safe and comfortable with each other regardless because we understand that possibility in terms of substance use health spectrum. But yeah, it's open to everyone. And in the preamble, we say something really neat that's unique. We say, you might be on any parts of the spectrum, but you might also be a family member, a friend, an ally. We even say you might be a professional, you might be a clinician. All are welcome. And there's an expectation that it is not just respectful, but so low barrier that it allows people to have the type of safety you see in real peer-to-peer communication, right? Where it's completely safe. And folks would know that if they've been in a clinical world or talking to friends and family that are having these experiences, looping back to the truth piece, right? When we reduce the fear and increase the safety amongst our peers, we connect with ourselves, then we can connect with others, a different story comes out. And when we tell that story, it helps redefine ourselves. Eh? It helps bust that idea that there's something wrong with me, like a fundamental ingredient of myself is defective. And so the meetings are very positive. They're wide open. again, we have a grounding exercise. I looped in at the beginning, I talked a little bit about this idea that we ought to think about connection in terms of self first. That's exactly what we do at All People, All Pathways. Evidence-based practice around journaling, right? So we get folks to, in real time on virtually, to journal. So when I use the pen and paper and I make a line, a mark, I draw or I write, it brings me out of that fear disconnected system we talked about, brings us into that, that presence that we would have. We call it neuroscience, would say prefrontal cortex or all that stuff. But really what we're saying is I'm able to sit with myself and believe I'm safe. And we do that before, right? As a starting point. Then we connect with others by explaining often our successes, sometimes our struggles. And the group workshops in real time, resources. So the question about resources, peer support, your peers, folks who have these experiences, they're the resource connection, right? So they know what's worked, what's not worked. There's a lot of wisdom in the peer rooms around that. So, and the meeting goes on into later ground and go through safety. Again, keeping with the theme that I must learn to connect with myself because I've been decoupled from self from a number of reasons, right? Socially, medically, the system, some of the healthcare providers that I've worked with haven't understood what I'm going through. My friends and family, although they want to support me, they're fearful for me. So they're imposing timelines. So it's just a place that's really so wide open in terms of low barrier that it creates that unique situation.
That's really helpful. I think, Hillary, that we've got time for one question, two at most.
Oh, it's going to be difficult to choose. Thank you so much, everyone. Thank you for submitting your questions. I'm going to go with, because Onawa, I know that you do a lot of research with women. So there's a question that came in around, so the question reads, would you say there is a difference between the way men and women seek out and engage in connection with others during recovery?
Oh, that's a good question. I think that there are differences, at least in the path that I chose, there's differences. When I was in my addiction, I had pretty unhealthy relationships with men. And so it was important for me personally, because I'm going to just speak about my own personal experience here because I can't really speak for everyone in all pathways. That was a really big part of it is the connection. And then also shifting from connecting with men and unhealthy relationships to connecting with women who supported me and who I was sure there wasn't any sort of ulterior motives. And so that was a really important part of the beginnings of the recovery foundation that I built. It's why I'm involved with She Recovers. I think their message is really important. It's an organization that supports women in or seeking recovery, any addiction whatsoever. So you can go to sherecovers.org if you want info about that. But I think that we actually, in partnership with that organization, I have a study that's about to launch that's looking at the role of female friendships and trying to determine what exactly is happening when two women connect and they're trying to get sober. And so that is underway very shortly here because it's something that we're interested in. And as I mentioned before, that peer connection, social connection is a theme going under all of the programs that I've looked at. I think that it's important to be connecting with people that there isn't any sort of possibility of a romantic attraction or a relationship. And that's another topic for another day. I could talk about that for some time. I've got a lot of data on that as well. But so the short answer to your question is yes, I think there is a difference. And I think that different pathways have different ideas about what that looks like. And the one that I chose was really emphasizing that you want to connect with people who there is no danger of, when you're in that really vulnerable space and looking for help and support, that it doesn't come in a form that might be harmful.
Thank you, Onawa.
Hillary, let's try and squeeze in one more question.
Okay, let's do it. Okay, so we have a question that came in at registration and just came in again. So I want to be sure to get this one in there. It reads, should someone with substance use disorder seek treatment beds for an inpatient treatment outside of their own community in order to avoid the codependency or stigma or enabler barriers to wellness and safety? Does anyone have any thoughts on that?
I'll jump in quickly, having engaged in both types of services and also been on the professional side of those services. This is a really common question, and it's a smart question, right? Because we were not sure what is best. I would offer just a question in response to the question, which is how could someone create the type of boundaries? Anna was mentioning boundaries, and we know it's a real clinical thing to say, and it's really true, right? How can we create healthy boundaries in a situation where we don't feel like we have to move so far away from all of our pre-existing supports? Okay, so if connection's a big thing, which we all are agreeing on tonight, then is it better or worse to move further away from our connections? And I think that's a unique and person-to-person situation. But if you're able to have, keep your health goals and have healthy choices and create a structure around you that you don't have to move far away from all of the things you love and go further into that isolation and that self-shame, which I've seen a lot of, maybe that's a good idea. So sometimes I say to folks, what does moving far away represent? And can you create it in a place that you're healthy just where you're at today?
Can I just speak to that very quickly? Because that was an important part of my experience is I moved and went to treatment far enough away that I wasn't in the immediate area where I had done a lot of drinking and that sort of lifestyle. Still wasn't very close to my immediate family, but it was important for me personally to be away from the temptation of the people that I had associated with before, but I didn't have the factor of, am I far or close to family? And that in the period of time where I was really wrestling with what does it mean to not drink or be sober, there were several times where I made a choice to go and visit with one of those people from my past and wound up drinking again. And so there's a balance. It's you have to kind of weigh what the temptation is and what the threat of that might be with the amount of support in that location. It's tricky. And I think that's the answer to a lot of these questions is it's really tricky. And that's why there aren't clear-cut instructions, right?
Can I just say that there is no add hot water and stir solution to people's lives, right? As we're multifaceted and complex people. But I'd also offer that people aren't human, Rubik's Cubes to be solved either. So as people put their solutions and lives together, yeah, it's very personal.
Maybe a note of wisdom to end on. I'd like to thank the audience who joined us. I want to thank each of the panelists. It's been terrific. Garrett Smith, Onawa LaBelle, and Shawn Fisk, thank you so much for all that you've shared. I want to thank Hillary Dort, who's the Manager of Communications at HRI, for fielding the questions in the background. To all the HRI staff who have done all the invisible work that's necessary to make this happen. And I especially want to thank our sponsor, CIBC, who's the corporate sponsor, and KPMG and the Otsuka Lundbeck Alliance. Without their support, we could not put this series on. So hats off, much appreciated. Some announcements. This session has been recorded, as you know. It'll be available. You can access it through the HRI website in the days ahead, and we'd encourage you to share it with others if you think they'd benefit from watching it. If you're interested in the next HRI talks, which will be in May, watch HRI social media or go to the HRI website and subscribe to get announcements. So again, many thanks to all of you who are in the audience, those of you who have done the work behind the scenes, and especially to our panelists and our sponsors. Thanks and good night.